Over the last 40 years, the number of Australians diagnosed with pancreatic cancer has more than tripled. Pancreatic cancer is the third leading cause of cancer death in Australia. It has significantly poorer outcomes than many other cancers and has a devastating impact on the lives of all those affected. A national and coordinated approach is required to improve outcomes and survival for Australians affected by pancreatic cancer. The National Pancreatic Cancer Roadmap identifies 33 key priority areas and 60 strategies for collective action over the next 5 years. These priority areas have been developed with stakeholders and cover all aspects of the pancreatic cancer pathway, including prevention, early detection, diagnosis, treatment, supportive and palliative care, and pancreatic cancer research. The roadmap is the first of its kind and sets a shared agenda to drive improvements in pancreatic cancer care, experiences and outcomes.
My name is Chris Bagley and I'm a member of the National Pancreatic Cancer Roadmap Steering Group. 3 years ago, I was diagnosed with pancreatic cancer. I have no evidence of the cancer right now. Because of its aggressive nature, every patient with pancreatic cancer needs the best, most evidence-based and coordinated care. This needs to be delivered by well-informed, skilled and trained clinicians in the most appropriate and supportive setting. The roadmap describes this very well. I believe that the biggest impact that could be made for people affected by pancreatic cancer is for it to be diagnosed early, before it has spread. That way, they can undergo potentially curative surgery along with comprehensive chemotherapy. Right now, that only applies to 20% of those diagnosed. My diagnosis was an early, incidental and lucky finding. This was followed by highly skilled surgical and cancer care in a well-organised, well-equipped and supportive centre. This is the reason I'm alive and feeling very well today. Luck should have nothing to do with survival.
Hello, my name's Lorraine Chandra. I'm a chair of the National Pancreatic Cancer Roadmap Steering Group, and I'm a medical oncologist and I work in a regional area in New South Wales. I've been treating pancreas cancer for almost 20 years now, and I'm struck by the tragedy of this disease and the fact that only modest improvements have been made in treatment for pancreas cancer over my treating lifetime. This current project is a really good example of the way in which Australians can work together to get things done in the field of pancreas cancer. I believe that by working together, we will raise awareness of pancreas cancer, which will in turn raise resources and increase the enthusiasm to work together to make a difference in this disease. I urge you to help us do that in any way that you can think of, because we will do it.
Hi, I'm Jessica, and I lost my mother, Rochelle, to pancreatic cancer. I was one of her primary carers. I'm also the chair of the World Pancreatic Cancer Day Committee. By raising the profile of pancreatic cancer with the medical community, the general community, and those who fund medical research, we must provide some hope for those affected by pancreatic cancer over the next 5 years. I hope that the roadmap leads to much needed research into better detection methods and better treatment options.
Hello, my name is Shannon Gallagher and I am a pancreatic and upper GI cancer specialist nurse, a former carer for a patient with pancreatic cancer and a proud Wiradjuri woman. When I reflect on my First Nations patients, I think about the fact that Aboriginal and Torres Strait Islander people with cancer experience worse outcomes than other Australians. I would like to see the future of pancreatic cancer care change for our First Nations people by having culturally appropriate services. Understanding our First Nations culture will make us better clinicians. Supporting them and their families through this journey will make them more engaged. Reducing the impact of cancer amongst our First Nations people is a crucial aspect in closing the gap in health outcomes.
Hello, I'm Irene Hunyadi. My friend had pancreatic cancer and I was his carer. I was able to help Les because of I'm a registered nurse, and I nursed many patients with pancreatic cancer. What I would like to see, more research into the cause of pancreatic cancer. Why are these people getting it? I would like to see more caring and compassionate approach to someone whose English is not their first language.
Cancer Australia has created the roadmap as an interactive, easy-to-use, web-based tool. We welcome you all to visit and use the website as a guide to support improved outcomes for people with pancreatic cancer, their carers, and family members.